So, did we look at the Komodo dragon?
No.
I know we looked at the iguana.
Yeah.
And we looked at the tuatara.
Mm-hmm.
Okay. So, just to very quickly review, okay? And I'm just going to run through this quickly because we got all this before.
Sorry.
Okay. Lower temporal arch. Okay. So this is a lepidosaur, but it's not a squamate. It's a rhynchocephalian. Sister taxon to the squamata. Okay. It's got that lower temporal arch. That lower temporal arch makes streptostyle movement of quadrate bone impossible. Okay. But you do all recall, it was on the exam, okay, 2 rows of teeth on the upper, maxillary and palatine, mandibular teeth on the dentary of the lower. They have a sliding joint here, and that's how they saw their prey up. Okay. Acrodont dentition. Right. Now when we get to the squamata, the lower temporal bar is lost. Okay. Not really, not very streptostylic on a green iguana, but this is what allows movement of the quadrate around its dorsal articulation with a squamosal bone. Okay. See the little specialized kind of spatulate teeth for its herbivorous diet. Now, we'll take a look at the Komodo dragon. This is an animal that has more developed streptostyle. It has a much looser articulation. There would be a joint here. It's just a little hard to see since it's a cast. Okay, but it has a more mobile quadrate bone. World's largest living lizard, and it's got a little bit of cranial kinesis too. It's got pleurodont dentition like all lizards except for agamids and chameleons. Okay. It's got these compressed blade-like teeth that can cut flesh. Alright, here's the Gila monster, and you can see if you look in there, all the usual skull bones are there. You can see all the bones in there. Okay? Various bones. So if you look carefully, you can see your various bones in there, but it has this covering of osteoderms. Okay? So that makes it basically impossible to see the rest of what's going on in there. Okay? You have these big concavities on the lingual face, right where I'm putting my pinky, okay, where the venom glands are, the mandible of these guys, and it's hard to see on the if you use your imagination on the front face, you can see a couple little grooves on there. They're easier to see on an actual specimen. Okay. All right, so let's look at snakes. So let's see. So here we have a boid. This is a green anaconda. Here's a pythonid, a reticulated python, and they're pretty similar. A good way to tell the two apart is you got a couple little teeth on the premaxilla on the python. Okay. The boid doesn't have that. Here's the premaxilla. So you can see on a snake the premaxilla and the maxilla are not connected the way they are on almost everything else. Okay. So, you know, lots of reduction in loss. In snakes, if you compare it with the Komodo dragon, here's the upper temporal arch on the Komodo dragon. Okay, it's gone on the snake. So they've lost the lower and the upper temporal arch. Okay, and that's associated with really high degrees of cranial kinesis and streptostyle. All right. So let's look at some of the bones here. Okay, so here we've got our maxilla with the maxillary teeth, our dentary. Okay, you all know in tetrapods, if there are teeth on the lower jaw, it's got to be the dentary. Okay, and then your post-dentary bones. Here's your quadrate bone. I'm actually going to use this one. You know, I just noticed after a number of years how different those two quadrates are. I'm thinking that either it's an old injury that healed up, or it's some kind of deterioration of the bone in an old captive specimen or something. Okay, we'll look at the python. Quadrate bone. Okay, highly mobile both at the quadrate articular and quadrate supratemporal articulation. There's the supratemporal bone. Okay, the supratemporal bone, you're going to have to look closely at this. If you look at that little nubbin, that little crescent right above my fingernail, okay, See that, just a little tiny bone? Like a booger. Okay, that's the supratemporal on this lizard. Okay, this is the supratemporal on these snakes. Okay, you also got a Lappin viper. Yeah. Now, that greatly increases gait, having these elongate quadrate bones. Okay, supratemporal, bringing way back from the brain case. Long mandible. Okay. So here's how the snake eats. So in this case, the python would strike, grab onto something, constrict it. Okay. And once the thing is dead, okay, cardiac interference, it seems to be stopping blood flow through the major blood vessels. That's how it happens. It's not suffocation. Okay. And then what it'll do is it'll disengage its jaws. Okay. Now the maxillary teeth in the premax basically don't play any role in ingesting the prey. Okay. The teeth that do are the mandibular teeth and the pterygoid here, the pterygoid palatine complex. Okay. The pterygoid here and the palatine. So you can see in the upper they've got 4 rows of teeth. Okay. So what happens is, one side at a time, okay, they'll disengage the jaws. The quadrate, which will be flaring out too, rotates forward around its dorsal articulation with the supratemporal. Okay. As it rotates forward, the mandible is protracted forward. So the mandible is and at the same time this happens, as the quadrate rotates and protracts the mandible, if you turn it over, you can see the quadrate bone here is attached to the pterygoid bone. Okay? So as it rotates forward and the mandible moves forward, the pterygoid also moves forward and moves the pterygoid palatine complex with its teeth. So this whole unit moves separately from the incredible kinesis from the rest of the skull, moves forward simultaneously with the mandible. Okay? Then they engage the teeth of the mandible and the palatine pterygoid complex. Then they open the other side, rotate the quadrate, mandible moves forward, connection here eventually with the pterygoid palatine complex, moves those forward, closes, and they just kind of walk their head over the prey. They swallow it down. And here are a couple of venomous things. We don't have an example of a large venomous colubrid or an A-tract aspid skull. I don't think there's a replica out there. But this is a king cobra, and so basically 3 kinds of venom conduction. Okay, in snakes, you got the large rear fangs with grooves. Okay, the snake has to kind of chew to get the venom into the animal. That's independently evolved many times. Then you've got fixed front fangs. Okay, evolved once, most likely, and that's in urolapids. Okay, so your coral snakes, cobras, mombas, kraits, all that stuff. They're fixed, they don't move. This thing has a short maxilla, okay, a pretty short maxilla compared to one of these more basal boids or pythons, okay, but it's not mobile. It's not mobile, all right. And you can see afterwards, if you look real carefully, you can see the opening, the duct for the venom there. And this thing's kind of interesting as, like I told you, a snake-eating specialist. And it's got these little robust hooked teeth that are kind of good for hanging on to swallowing the snakes, possibly. But that's a king cobra. And then you've got this one. This is a gaboon viper, okay, an old world viper. And this thing can eat small deer where it lives. Okay, pretty incredible. Again, the vipers are the champions of all snakes in eating prey large relative to their own mass. All right. This one, the mouth is open, so it's really wide, so it's a little hard to compare with some of the others. But one thing to notice is that here's the quadrate bone. I mean, the quadrate bone is almost as long as the rest of the skull. Okay, supratemporal, which is actually mobile on the skull there. Okay. Interestingly, it has well-developed mandibular teeth and the palatine pterygoid complex for ingesting prey. But as far as capturing prey, the maxilla, okay, which on this animal is that whole thing right there, goes all the way back to here, okay? That's the maxilla, just this thing. And it's mobile. Another degree of cranial kinesis you see in the viperids. And that's how they erect their fangs. So the fangs are folded back at rest, and when they strike, there's a muscle that erects them, so then they stab it into the prey. So there are no maxillary teeth. The only maxillary teeth involved even in capturing prey are the fangs for injecting the venom. There's nothing going along back here. And those have evolved once. And then we've got the atract aspids that they probably evolved separately. Probably the longest fangs of any venomous snake. Apparently they're really reluctant to bite. You walk in front of one, but if you step on them, then you're pretty much done, because they are very, very tissue destructive. But this snake, would have a body about that big around, and it'd be like 4.5 feet long. Yeah, it's pretty cool. I think that's it. I'll holler if I think.